previous patient just left, so we can get started right away. Are you ready? Okay, and have you done a cranial nerve exam before? You have some experience. Okay, so a lot of these tasks should be pretty familiar to you then. Okay, I'm sure you'll do great. Well, in that case, I think we can just go right ahead and begin. Let's begin. Let's begin. So, to start off, I am just going to take a physical look excellent. You are doing a pretty good job, okay? Pretty good, very good, very good. Okay. Excellent, excellent, excellent. Your vision seems to be pretty intact, so I think we can move on to the hearing portion, okay? So, for this portion, I'm going to have you close your eyes, close your eyes, close your eyes, close your eyes. Good, good. And what I'm going to do is make a sound with these gloves in either of your ears. And your job is to tell me whether it is your left ear or your right ear, okay? Let's begin. Which ear was that? Your left. Good, good, good. Okay. What about now? You're right. Excellent, 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 excellent. What about now? Left. Yes, 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 yes. Okay. What about now? Left again. Yes, good, good, good. What about now? Right. Yes, yes. Excellent, excellent. Okay. One more. What about now? Both. Yes. Very good job. Very, very good job. Okay. You are doing pretty well. Let's move on to something maybe a little more difficult. But keep your eyes closed. Keep your eyes closed for me. I am going to be saying a word or a number at various volumes and levels of intelligibility. And your job Yeah, that was a difficult one. What do you think I said? No, not quite. I said dinosaur, dinosaur. That was a hard one, so don't worry about that. Aside from that, your hearing is pretty perfect. Let's try some numbers, okay? The first number is 15. What number did I say? 15. Yes, yes. Excellent, excellent. What about now? 142. What number was that? Almost. Almost. I said 142. 142. Okay. Let's do another one. Okay. Are you ready? Pay attention. 88. What number was that? 88. Yes. Excellent. Excellent. You are doing such a good job. Your hearing is pretty good. I have not noticed anything worth noting, so that's a good thing. Okay. Alright. We are going to move on to our smelling test. Okay. For that, I have a series of markers that I am going to use to test your scent, okay? No, you don't need to close your eyes. You'll see why in a moment, okay? This first one, could you tell me what color it is? Let's test your color perception. What color is this marker? Red. Great, great, awesome. More specifically, what type of red would you call this? I'd say so too. It's sort of a red-orange, maybe a blood orange if you're feeling fancy. It's not a true red, right? Okay. Now, I want you to give it a smell. Give it a smell. What do you smell? What scent do you smell here? What scent? What scent? Take a nice deep breath. Take multiple breaths if you need to. What does it smell like? What does it smell like? That is correct. This smells like coffee. That's why I told you you didn't really need to close your eyes. We use this color to trick people, so to speak. Although it may look like this would smell like cherry